Well, that Valium, how's that Valium? We definitely have a cool patient here. And so I want to give you the context of what's going on in terms of what we're kind of, well, what do we see here? Tell them a little bit what happened.
I've been struggling with gynecomastia since I was about 12 years old. And the past couple of years, I realized that, 2 years ago, I realized that there is no way to fix it other than surgery. So it's been kind of a journey financially, and just trying to find the right time to have the procedure, and the time finally came. So here we are.
Yeah, but tell them what happened. I mean, you lost 1,000 pounds.
Oh, yes. So I got up to about...
Not 1,000.
Feels like it.
Yeah.
I got up to about 250 pounds in 2017. And since then, I've lost almost 100 pounds. I'm about 165 fasted. So
100.
So awesome.
Yeah, no. So 100 is absolutely humongous. And everyone has watched my videos over time. I'm always like on a 5-pound weight loss, and I'm always moaning and groaning about 5 pounds. And then you have people like you that lost 100 pounds, which is amazing. So you could see he's got some laxity of his skin. I mean, you know, there's no question about it. I mean, this is but you know, this is a learning thing. So, so the deal is with him is he's going to be an experiment of sorts, and he's agreed to be that experiment only because we're going to cover our bases and make sure no matter what happens here, we're going to take good care of him, because he's just that kind of guy. And so am I, actually, and we kind of see each other as we see eye to eye, so it's kind of cool. So this is the experiment. I mean, I think obviously we know this is loose skin, and he's lost a lot of elasticity in his skin. But when I see him, it's sort of like, I mean, look at his skin. His skin is nice. It looks good. He's fit as a fiddle, and he's young. Right? So in my mind, I'm like, well, you know, actually I can always excise this skin, you know, we can kind of, he'll have a scar through here. But I'm saying to myself, can I possibly do my thing and sort of redistribute this skin up here like this, and use my quilting stitches and my wide, so in other words, can I use some of my techniques that I've talked about in my videos, and I will be hopefully publishing soon. Can I achieve a result that's pretty reasonable, okay, without the scars? And that's just really the bottom line. So now, I mean, what am I thinking? What did I tell you? Because we're like, well, it's almost feel like we're gambling, right?
Yes.
And I'm like,
yes.
He's local, so it's not like he's traveling from halfway across the world like some of my other patients. And so I don't really see any downside, because if I can achieve this result without the scars, I mean, I just think that's really cool. I think then you'll feel probably better about going out into public and stuff, right?
Yeah.
And so that's really the goal. I mean, I dare say even if we have a scar that looks pretty darn good, he still feel pretty good, right? So I think all the options are out there, but I think if I can get him to a point where it's just really good without the scars, that's the way to go. And so we're also leaving a fallback, so if we can't achieve our goal out, so in other words, I give him a few months or even a few days, if I could tell its skin is just beyond working with, then we'll just cut it out. And we'll actually show that as well in the video, so that we can sort of get this whole journey. So it's a little bit of an experiment. And so one of the things I try to tell people, you know, medicine is not like some other fields of science. It's not an exact system. It's not an exact science. And so we learn, you know, and so I'm actually using him as a learning tool, but we do learn on people, and that's how doctors learn, you know. That's why we call it practice, you know. And so you may be watching this video and say, well, geez, Doc, you've been doing this for 30 years. Well, I have, but, you know, I haven't really engaged something like this and tried what we're trying today. But we're doing it in a good way, too. It's not like we're tricking him or anything. It's being honest, and really what we surgeons do is we always have fallback positions that we feel are good. So worst case scenario, guess what? It doesn't stay up. And so I just do a skin resection anyway, and all that kind of stuff. No big deal. And we've already talked about that. And it's just really the excitement of being able to work with him, and him helping out a lot of people as well in terms of, you know, he teaches me something, and then hopefully I'll teach people something as well. And it's sort of just something I think will resonate with a lot of people as well.
I'm thinking that the time has finally come. It's been such a long, hard journey. A few short months ago, I couldn't even tell anyone about it, and now I've been telling everyone about it.
He's telling the world, actually, now. You know?
Yeah.
Why is that, you think? Because you feel like there's an end in sight?
There's an end in sight, you know? And I randomly have met a couple other guys that have had the surgery as well.
Yeah, it makes you feel
and have
less
experienced with it, or have experienced it.
Yeah.
You know, so
it's less that feeling of like I'm the only one who has this, and more of
right.
like, oh, this is actually more common than I thought.
Right,
we can
right,
talk
right.
about it.
Yeah, and there's some relief in knowing that I'm not this like special, unique.
You are unique. You are special, actually. He actually is, which is kind of
Special
fun.
in a different way, right?
Yes.
Yeah. How? I mean, this is not good, right?
Right. Correct.
Whereas
You put it
this
under your shirt, so,
with a
yeah.
scar, big deal. I mean, you know. But if I can get this without the scar, that's even a better deal. So it's really just deciding, and we're not trying to waste his time either here. So we're doing the best we can to kind of get things where they want to be. So anyway, let's go see. Let's go show you how we do it.
Let's do this.
Yeah, let's do it.
All right.
Bam.
Bam. All right, we have our patient over here
Hello.
behind the screen. So, Mar, tell us, this is a local anesthesia case then.
Yes, so he is awake, and we just actually numbed him, so he will feel a little pressure, but if he feels anything, he can let us know, and we will inject him with some more local.
All right, this is the numbing. It's got some lidocaine in there, mostly just IV fluids.
Well, what's interesting is look here when he lays back, everything is at a good position. So it kind of really what you see here is where the nipple is relative to the inframammary fold, and relative to his pec muscle. So his pec's up over here. He's got some tissue in here, which is we're going to remove because that should be helpful in creating this sort of healing environment that we're seeking to do. Now, one of the things that so I'm going to put a small incision here in the axilla, in that hair-bearing area. This is the part where we have to put in, this is numbing medicine, but it's also the fluid that works for the Vaser that we're going to use. And really, the Vaser is not as much it'll help me get this tissue out for sure, but it's to possibly help with the skin retraction. But I'm not real, motivated by that as much as just allowing me to remove this tissue that I have under here. So, okay, so we're at the Vaser section here, and then the Vaser basically is ultrasonic energy that is being used to treat the tissue beneath his nipple, areolar complexes here, because obviously he doesn't have a lot of fat. So, but he does have this tissue underneath the nipple areolar complex, and this Vaser is going to help me release the tissue so that I can remove it completely without using the electrosurgery device, and it shrinks it down nicely. I'm really not concentrating on removing a lot of stuff because he just doesn't have a lot of stuff. But he definitely has some gyno tissue at his nipple areolar complex, and that's really where I'm concentrating. Now, one of the potential benefits of the ultrasonic energy is with skin retraction, but I'm not, anyone who knows me, I'm not overly thrilled with the whole concept in the sense that, maybe it gives us a little bit, but it's not going to give us a ton. And so I'll go more superficial. You see here where I could theoretically go more superficial, and there's been a lot of talk about lately with radio frequency skin tightening procedures, and I could tell you honestly, don't get overly excited about it, and more than likely if it does do something, it's such a minor contribution that it's almost not even worth talking about. And I hope I'm wrong, but I'm probably not. There's not going to be this miraculous skin tightening where all of a sudden everything goes back. I dare say if you're showing it before and after where it did, it was going to do that anyway. And then it's easy to think that it's because of the radio frequency device that you used. In essence, what you need to think about in terms of this whole idea of skin tightening is it's burning. And I'll give you a quick story about a patient that I saw when I was young in training. And she looked like she had a facelift on one side, and the other side was just looking a little bit older, right? And so it was just it was odd, you know, and I'm like, God, she had a facelift and they must have stopped for some reason. They didn't do the other side. But that wasn't the case. What she was is she was in a fire and she was burned. And what happened is the face that was burned, the skin was burned just enough where she sort of had this rejuvenation because it made scar tissue, and the scar tissue just kind of made her face look more youthful. Okay, so a lot of these devices that we use are all based on imparting energy to the skin with the hope that it's going to make that skin contract. It's sort of like, and again, I don't want to get weird, but it's like cooking a steak, you know. It could be soft and, you know, kind of blubbery one minute, then you cook it on the grill and it gets a little firmer, right? So the skin will get firmer when you add energy to it. But, you know, the issue then becomes, well, all right, if you burn it too much, then you got burned skin. If you don't burn it enough, you don't have any effect. And how we sort of determine what is the proper amount of energy and all this kind of stuff. The other way to look at it too is that you can't ask the skin to do too much heavy lifting, which basically means that this skin is small. I mean, it's almost like it's thin, right? And so I don't care what you do to the skin. If the chest is kind of big, it's not going to hold anything up, you know, and it's not going to really do anything per se. So, you know, sometimes I feel like I ramble with this stuff, but needless to say is you can cook the skin up and it may make a difference, but it's usually a slight difference. And so don't get your hopes up high with any of these skin tightening alternatives. There are other sort of natural body healing processes that we're going to work with that's going to be more pertinent to his success, okay? And that's going to be moving the skin physically and then securing the skin physically and then letting the normal healing process possibly produce this sort of scar that will hold it there. And that's really simply the way we're approaching this case. So it's not like I'm looking at it as, oh, we're going to cook this up with this ultrasound and, you know, and skin's just going to miraculously go up. That's not going to happen. We're going to redistribute the skin and we're going to secure it, and we're going to show you how we do that. All right. Okay, so I've done my Vaser, and the Vaser has melted some of this gyno tissue and created some of the heat effect, if you will, because this is actually a little bit warm. So that's the sort of the potential benefit of the technique, is to impart energy to the skin so that it denatures the proteins, and therefore maybe the skin will contract and we'll get some skin retraction. But that's really not what I'm lying. That's not going to do the heavy lifting. Heavy lifting is going to be what I'm going to show you next. He's got a little bit of remaining stuff right here underneath the nipple that I'm removing. Other than that, pretty much done removing some of this fluid. All right, through that tiny incision. This is where I'm going to be doing all the work. So I do it at the areola border, which is a natural incision that hides things pretty nicely. It's the proverbial where the ocean meets the beach.
You like his metaphors?
You hear him anywhere else online?
Yeah.
Where they came from.
Yeah, hint, hint. People who copy my stuff word for word is interesting. Hey, buddy.
Mm-hmm.
You're not on any blood thinners or anything, are you?
No.
So I'm going to take out. No, I'm just a question. So this is the material that's underneath the nipple areola complex that when we're done removing it, okay, we'll make it smaller to some degree, because this is what keeps it sort of puffy. So this will keep this from kind of sticking down, so that's why it's a good thing. I'm going to remove this for that reason alone. So.
Oh, you're gonna like this part.
Yes.
That'll look cool. I like it.
And so this is a rubbery part, the gyno part, okay. And like I said, he doesn't have a lot of fat, so I'm just looking around here. I'm actually going to put in a stitch, so let me show you here. See how this dips down a little bit right here? I'm actually going to put a stitch in that's going to help this situation out. My internal stitch. So I'm grabbing some of this upper. Okay, so let's kind of do a little touch up where we are. So a few things we discovered is he's a little bit bloodier than usual, and that's not uncommon when people with weight loss because their vessels stay pretty large even after they lose the weight. So that's going to slow us up a little bit, but it's not a huge deal. I removed some of the fat in this area here, and I removed this tissue that he has immediately underneath his areola. And I use an internal flap of vicryl material just to make sure that there's an even layer of this fat layer that remains. So there's no depressions or divots or anything like that. So if I go here, this is the extent of my dissection. You see right here. So it's essentially right here where I actually remove the tissue. But remember, what I'm trying to achieve now is I want this skin in this area here to go north, right? So wide undermining basically means I need to dissect up in this region, okay? Because I want this skin to redistribute north or towards his head up over here. You can see already we're undermined up to here, right? So see this? This is all undermined, and we got to do more. But I'm going to do it slowly and carefully so that we get it nice, okay? So you can see more. It's like a parachute that when it comes down, it's all folded up, but that we want to push that extra skin up north so this nipple comes up north as well. Hello. Yeah. Well, now Valium. How's that Valium?
I know. How did it affect you at all?
It does now.
Yeah, a little bit.
Mm-hmm. I've undermined, and so the undermining basically means I've raised the skin off the chest over here. It actually looks different already. It's laying differently, but if I stick my pen in here, you can see, look, all right, this whole area that I marked is now free. So this is called undermining. He was bloodier than usual. I had to use my electrosurgery device, okay, but this is undermining. So if you look in his position now when he's laying back, that nipple's in a pretty ideal position, and here's his pec, here's his border right here. And I'm going to shift this, all his skin north, like that, okay? So it's even exaggerated. But now I can shift it up like a wave. I could shift it up because I've undermined it. Otherwise, it would just be stuck. So what I'm going to do is I'm going to shift this skin up. My nurse is going to hold this a little bit, and I'm going to put some of these quilting stitches in various areas. You could hold that like that more in order to hold it where it needs to go. So quilting stitch is something I've talked about extensively with eliminating dead space. I'm going to grab a piece of the skin here. I'm coming down on the other end. I'm way up there. And I'm going to grab the tissue below. And then I'm going to tie this up. Going to be a little bit of a reach, but you see how this stitch is going all the way up to there. See that? Boom. And that's bringing that skin up there. And it's securing that skin up in that area. So that's where it's going to want to heal, right? That's where I want the mortar to stay. So that's a vicryl stitch. It's absorbable. Okay, and this is normal. It's going to be stuck a little bit here. Boom. But that stitch right now is there, and now, see, it's stuck. So this skin has been moved up north, And now I'm putting in these additional sutures, quilting sutures, if you will. All right, so we're going to do a little update. It's been taking a little bit longer than I thought because it's just a lot of stuff, and he's has big vessels because he lost all this weight. But so we undermined this whole area up over here, all this circle, okay? And I shifted everything above. So if you could see his nipples at the low part, now it's above. His fold is here, nipples up over here. And all the space is now blocked, okay? Not every space, but he's got stitches that are designed to hold the skin up. These are these little dimples here where these stitches are, so that I want this new skin layer to essentially adhere where it is right now. That's what we're hoping, and that's the premise of this whole procedure. So, so far so good. And it's the quilting stitches, wide undermining. I did some internal flaps, so I threw the whole kitchen sink in this case. And now we're going to basically do the same thing on the other side. We're sitting them up, and skin is not coming down at all. You can already see that because it's being held up by all these little stitches on the inside. That's all these little dimples. Those are all those quilting stitches that you could see. This little rubber hose is what we call a Penrose drain, and that's just to allow some fluid that's going to be on the inside to just come out. That's going to stay in there for a few days, and we're going to collect this fluid. So right now we're at this stage. Everything went fine. It was good. It was a lot more than I thought in a lot of ways, but it went great, and I stuck with it, and it worked out nice, and he was cool. It was under local anesthesia. We know it's up now, so the real issue is, will it stay up? And so that's actually the part of this video that's going to be the cool part, and I'm going to keep my fingers crossed and hope that it stays up. And I want this to be a success for a lot of reasons. So there you go.
All right, how you feeling?
Good. I'm excited.
You can't take it home with you. I'm sorry.
I cannot.
No.
You can't cook it up later.
But you can.
That's a shame.
And then this one's your left.
What does it feel like?
I don't know.
So patients will know what it feels like.
Here, show us up here in the sun.
Sometimes it feels like, I don't know. This one definitely feels different. This one feels more like, I don't know, nodular. I don't think that's like, maybe that's the right word. Kind of like gum.
Yeah.
It feels like gum, like chewed gum. Like a,
That's actually a good.
That's a
That's
good
a new
one.
I've never heard of that.
you know,
But that's a good
not
one.
like couple hours chewed, but like
Yeah.
maybe like 30 to 40 minutes.
Yeah.
It hasn't completely fallen apart. Okay.
Show us
Yeah.
this one.
Yeah, this one's definitely different. Why is the color different on this one?
Well, you got fat
You have-
on there too.
yeah.
Okay.
So you're looking
Yeah.
at fat and gland and.
You know, I'm surprised
All
it's
sorts
that
of stuff.
small.
Okay, so here we are. We're at, how many weeks are we now?
2 weeks.
We're 2 weeks out after this sort of experiment that we've been talking about all along. Show them what we've been dealing with. Okay, so big time weight loss, big time skin laxity. And the experiment is, can we do some techniques to get things up where we would prefer to have them, right? So here we are now, 2 weeks out. He's indurated. You have a little bit of these little fine creases here, but things are definitely up. We got most of the induration down over here. This is like what I would call an 85% improvement on where we're going. And we may never get there. We already know this. But we're seeing how far we can go. So 2 weeks out, we're pleasantly surprised. The jury's not out yet, but we got a ways to go. So he's going to go into his garment. He's going to keep, I mean, look at that. That's the sad thing. This little lift right here, we're home free, right? So we're trying to attain this goal here. I guess you can walk around all day and just go like that. But we're dealing with skin at the end of the line, and we're trying to keep him as perfect as possible, really.
All right, how do we get there, Dr.
Well, I'm gonna go pray. I'm gonna keep my fingers crossed, and we're gonna keep hoping he's gonna keep doing it. Now remember though, I want this scar tissue that's here, all this swelling and all this kind of induration here is essentially mortar that's gonna form here, and that may pull that skin back. So don't be so pessimistic. Let's just be optimistic. Let's hope for the best, and we'll just see how it goes. In the meantime, he's gonna keep good posture. He's gonna stay in his compression garment, and he's gonna think positive thoughts. I don't know. I feel good, but not 100%, because remember, us plastic surgeons are all about plastic surgery. And so plastic surgery, it means to mold, okay? It's the Greek, plastikos means to mold. So I'm trying to mold his skin. Now, obviously it would be easy just to excise his skin and be on with this, but I just wanted to sort of see what we can do and really share this with you folks real time, because I'm not going to penalize him if his skin doesn't go back and I have to excise it. It's not a big deal. And we talked a lot about this, and it's kind of a personal thing. Remember, the goal is to try to get him where his skin is nice without these big scars. Now, having said that, for those people who I do these scars, you needed these scars, okay? I had to put those on. It's not a big deal. Him, I'm just trying to see if we can just really achieve the nth degree, nirvana. I mean, and because he's just a sweet kid, and I'm hoping for him, but I think that as the swelling goes away to some degree, that the skin is going to get a little lax at the bottom. But you never know, and so that's why we're going to kind of ride this together. But as you could probably tell, this is personal. I mean, it's easy for me to be a callous guy and just say, well, whatever. But no, I mean, this is kind of personal. I really hope we can get that. So I'm personally invested in this, and I do want it to work out nicely. So we'll see. God. Are you getting this?
Uh-huh.
Okay, so my man here resorted to going in the sun excessively and has the most unbelievable shadowing I've ever seen from scars. That's pretty impressive, my friend. Totally. All right, so this is what we got. And as you could see, now that a lot of the swelling has gone down, we definitely got the nipples up. They're on a flatter surface. You could see where here they're falling off the edge. So they're up on a better surface right here. But he still has some lax skin in over here. So I would assume that that's a decision. Put your shoulders back, Shane. Yeah, that's a decision what we have to make in terms of, is this bringing us nirvana, or do we want to go ahead and do a little bit more? And that's really the decision today. So definitely an improvement, but what's funny about this, it's not about, it's like we're trying to learn about the limits of skin and what skin can do. So we definitely made some nice improvement, and he's always been an experiment of sorts, but now we have to decide what we want to do. What do you want to do?
I definitely want to
skin.
Fix it.
Good, I like that. And your scars, you're okay with the scars, right?
Yeah, I'm okay with the scars.
Okay. Now the question is, and look at funny how it's just a matter of millimeters. You see that? Isn't that weird? Mm-hmm. That little bit there, and then boom. That's perfect, right? And so it's just, we're at the end of his sort of his skin laxity. Okay, so sit down. Let's take a look at how we would do this. And so the issue right now is how best, you look, man, you've been lifting weights and stuff.
Mm-hmm. He's pretty boy.
He's been working out. So the question really is now how we treat this. So one way would be just around the areola itself to pull things in, but that's really not going to get this tissue out on the side over here. So it really, if I look at this, Isn't that amazing? That little roll right there.
And there you have it. That's
there
what
you
want
have
right
it.
there.
Would you make is it okay if I make your nipples slightly smaller?
Yeah, that's fine.
Your areola is smaller?
Yeah.
Okay. So let me mark. So really what I would think about doing in his case, the nipple is a little collapsed here, and it's definitely heading in a southward direction. So one of the things I can do is reduce this tissue through here. But when I do that, it's going to pull this down a little bit. So in other words, if I just sort of kept let's say the incision like this, he'll have a scar underneath this area, which is nice because it's adjacent to his muscle, and no scar around the areola. But you can imagine when I kind of pull this in a little bit, it's going to pull that nipple down a little bit as well. So the other option really would be to do a more global excision. So let's say I extended it from here and sort of did this, right? What I can do then is just reposition the nipple areola complex to a higher level, and the final scar would travel sort of in this direction right in here. So that's really, and then we want it to be relatively symmetrical. So again, it's the difference between an incision down here outside of the nipple areolar complex or one that actually includes it, okay? And this will be smaller, and I can reposition this a little bit and pedicle this to a new level, blah, blah, blah. That's what we're trying to think about. Right? What do you think? Do you want your nipples higher, or would you just prefer a scar, like keep your nipple as it is and just take out some of this loose skin underneath? The problem with an incision around the areola is that it could look like a pizza pie, you know, and that's not always the coolest thing in the world. And if we just took out some of this loose stuff down here, then you can imagine I leave the nipple as it is and then just take out some of this skin, and you have a scar that's just more in the lower part down over here.
I think I'd rather have the scar there.
Then up over here?
Yeah. Right?
Yeah.
Well, there is pluses and minuses.
Yeah,
to
it's
that
all
too.
pluses and
like you may have a little bit of laxity still, don't you think?
Well, he'll have a little bit, but you know, I think that his nipples are actually looking pretty good. I mean, it's like everything in life. It's all about a compromise, you know. I mean, it's like, you know, I do the whole thing here, and then he has a scar that comes across through here, and then one around the areola. I mean, his areolas are not that big. They look good, and they're flat. So, you know, if I can just take out the skin down over in this area here and keep the scar at the bottom of his pec muscle, I'm thinking that that would be pretty good. I mean, there would be some downward pull on the nipple areolar complex, but I don't think it's going to be terrible. And I think that it's sort of like if you see on guys that are in super good shape, sometimes the nipple is always on the lower side of the chest anyway, because that's just the muscle kind of pushes it out. You know, the problem with an incision around the areola is that, you know, when you're done, it looks like this nice little fine thing, but then, you know, over time it could just spread, and then you get like hyper and hypopigmentation, you get color changes, and it looks like a pizza pie. Whereas this, I think, in his particular case, I can sort of, you know, really achieve a lot of our objective and keeping the scar in an ideal position below his chest. But, you know, a lot of that input has to depend on you, you know. I mean, it's like if you say to me, geez, you know, if your areolas are really big and you want them smaller, then we definitely go around them. If you wanted it to be at a much higher level, then, you know, we have to,
that's everything right
you know, we have to move them kind of thing.
Okay.
I think they look pretty fine just down over there. That's sort of where they're supposed to be. But if you wanted them up over here, but that looks kind of weird up there, I think. He's got some serious pecs in here, man. You've been working out a
I
lot.
don't think you have to come up that much.
Man,
For sure.
yeah, well, but I mean, it's like, so keeping below here is just going to really move your shoulders forward. You see how a lot of that skin is just below that area anyway, you know? So, you know, my inclination would be, it's up to you, but I probably would stick away from the areolas and go below.
Okay.
And
So you just come right across here, your incision would just be right across here then?
yeah.
We just brush against that?
It just goes right where you have this little extra stuff here. We just take out some of that skin and fat, and it's easy peasy.
Okay.
Easy peasy. So the funny thing is, we did get a lot of benefit, and this is the beautiful thing about this video. I mean, guys, you're seeing this really real time, and this was an experiment, and this is not like a failure of sorts. You know, what you're learning is what I've learned, and it's the limitations of the skin. Now, I don't think I did not unanticipate, if that's a word. Not sure I didn't anticipate that we would be here, actually. In other words, there is a really nice difference, but human nature really has to take over here. Now, it's like, okay, so great, we made a nice difference, but did we get to that point where this person is there, right? And then sometimes you have to take steps to get where we want to go. Instead of just cutting people open, let's just see how we go. Maybe another person would have been perfectly fine, but for him, you know, we can do this. Now, I could say that the way we're doing it now, the scar is going to be a lot smaller, and if there's no scar around his areola, well, that's a huge difference. And so we did get gain out of the whole thing, and if we learned a little bit about things, it's just food for thought. I mean, for all you other people out there that have sort of like his history of losing all this weight and everything, you know, I would love to be able to get that skin back without scars, but guess what? Sometimes you just can't do that. And, you know, and just, it's like you got too much fabric, and we got to just take out some of that fabric, which is really not a big deal. that's where we're at. And so it's a good day. It's not disappointing.
No.
It's life. It's cool,
is.
and I appreciate his patience during this whole journey. But you get to see the journey in a snapshot in a video, whereas we take. How long has it been?
It's been 3 months.
Yeah. And how often have you seen a video like this? I dare say.
Never.
And so what's beautiful about our practice, my practice, and people like him is that, we are sort of at the cutting edge of sort of doing a lot of gyno, and I'm learning when you're learning, right? And we taught each other what skin is, and I think he's been patient enough to teach you what skin is all about. And what I argue with about a lot of with the gyno patients is the number one determinant of your result, believe it or not, is what? Your skin. Mm-hmm. If you got good skin, I can do all sorts of things, and you can guarantee that it's going to be an amazing result. People with extreme weight loss or maybe some skin conditions where everything is super lax, whole nother ball of wax. Mm-hmm. And oftentimes I'm asked to judge this skin on these virtual consultations, my online consultation feature, which isn't the simplest thing in the world, but certainly a history of 100-pound weight loss definitely adds into the skin laxity kind of question. But having said that, there are many people I've been able to not provide them with those big scars when some other surgeons had suggested that they do get it. And that's a big deal. So if we can save you from that, that's a big deal. Yeah. And so this is a case that's actually going the other way. But it's all good. And I think we're going to actually reach a really kind of final result that's going to be